Excessive tea consumption is a hobby of many people because this beverage helps the body to cool down and lose weight effectively. However, is drinking a lot of tea good? This is a big question mark. So I actually face this problem at my home as well. So my mama really loves drinking tea, but there needs to be a bracket. Hello friends, here in this video, we are going to tell you about 11 side effects of tea you can refer to avoid getting it too much. But before I start this video, if you are new on our YouTube channel, make sure you subscribe to it and hit the bell icon also for further new video notifications. Let's just begin with the point number 1. Reduced iron absorption. Tea is a rich source of class of compounds called tannins. Tannins can bind to iron in certain foods, rendering it unavailable for absorption in your digestive tract. Iron deficiency is one of the most common nutrient deficiency in the world. Excessive tea intake may exacerbate your condition. If you have low iron but still enjoy drinking tea, consider having it between meals as an extra precaution. Doing so will make it less likely to affect your body's ability to absorb iron from your food at meal times. Number 2, high blood pressure. Overall, caffeine does not seem to increase the risk of heart disease or stroke in most people. However, it has been shown to raise blood pressure in several studies due to its stimulatory effect on the nervous system. Number 3, poor sleep. Because tea naturally contains caffeine, excessive intake may disrupt your sleep cycle. So, melatonin is a hormone that signals your brain that it's time to sleep. Some research suggests that caffeine may inhibit melatonin production, resulting in poor sleep quality. Inadequate sleep is linked to a variety of mental issues, including fatigue, impaired memory, and reduced attention span. What is more, chronic sleep deprivation is associated with an increased risk of obesity and poor blood sugar control. Number 4, nausea. Certain compounds in tea may cause nausea, especially when consumed in large quantities or an empty stomach. Tannins in tea leaves are responsible for the bitter, dry taste of tea. The astringent nature of tannins can also irritate digestive tissue, potentially leading to uncomfortable symptoms such as nausea or stomachache. Number 5, heartburn. The caffeine in tea may cause heartburn or aggravate pre-existing acid reflux symptoms. Caffeine may also contribute to an increase in total stomach acid production. Of course, drinking tea may not necessarily cause heartburn. People respond very differently to exposure of the same foods. That said, if you are routinely consume large quantities of tea and frequently experience heartburn, it may be worthwhile to reduce your intake and see whether your symptoms improve. Moving to number 6, pregnancy complications. Exposure to high levels of caffeine from beverages like tea during pregnancy may increase your risk of complications such as miscarriage and low infant birth weight. Yes, some people prefer to drink caffeine-free herbal teas in place of regular tea to avoid caffeine exposure during pregnancy. However, not all herbal teas are safe to use during pregnancy, so definitely you should check with your doctor before picking up any tea. Number 7, headaches. Intermittent caffeine intake may help relieve certain types of headaches. However, when used chronically, the opposite effect can occur. Routine consumption of caffeine from tea may contribute to recurrent headaches. Tea tends to be lower in caffeine than other popular types of caffeinated beverages, such as soda or coffee, but some types can still provide as much as 60 mg of caffeine per cup. Number 8, dizziness. Although feeling lightheaded or dizzy is a less common side effect, it could be due to drinking too much caffeine from tea. Generally, it is not recommended to consume that much tea in one sitting. If you notice that you often feel dizzy after drinking tea, opt for lower caffeine versions or consult your healthcare provider. You should not avoid these symptoms. Number 9, caffeine dependence. Caffeine is a habit-forming stimulant, and regular intake from tea or any other source could lead to dependence. Symptoms of caffeine withdrawal may include headache, irritation, increased heart rate, and fatigue. Number 10, Frequent urination and urgency. Increased urination is a common side effect of high caffeine intake due to the compound's stimulatory effects on the bladder. You may have noticed that you need to urinate frequently when you drink more coffee or tea than usual. Number 11. Muscle breakdown. Rhabdomyolysis is a very serious condition in which damaged muscle fibers enter the bloodstream, leading to kidney failure and other problems. Common cause of rhabdomyolysis include trauma, infection, drug abuse, muscle strain, and bites from poisonous snakes or insects. Now I hope you understood all the points of side effects of drinking tea too much. If you like this video, then you should share with your friends, family and others. For further more videos, must subscribe to our YouTube channel, Fit and Care. You stay fit and good. See you friends in a new video with a new topic.